My name is Catherine Hill. I am Professor and Head of the Department of Entomology at Purdue University. So malaria is an infectious parasitic disease that's transmitted by species of mosquitoes called Anopheles mosquitoes, and it impacts the health of millions of people around the world, particularly in Africa, Asia, and other parts of the world. It has a huge burden on health. It causes a number of deaths, hundreds of thousands of deaths every year, and it also reduces quality of life for many people. For many decades, we've actually been able to achieve control, a really good control of malaria. We've been decreasing successfully the number of deaths globally every year from about 1.5 million down to about 470,000 deaths per year from malaria. But recently we've also seen an uptick in deaths from malaria, and that's because we're in a constant arms race with the mosquito for control, and we sometimes lose our ability to control malaria by controlling the mosquito. Around the world, billions of people are at risk for malaria. The risk for malaria in terms of human death, mortality and morbidity is greatest in malaria endemic regions of the world. And so these include sub-Saharan Africa and parts of Asia, as well as the Middle East and Latin America. So billions are at risk, and every year about 470,000 people die from malaria infections, and primarily that is pregnant women and young children. We tend to think that malaria is not a problem in the United States. Historically, there has actually been a lot of malaria transmission in the US, and then after the 1950s we had a global malaria eradication campaign that was very successful in controlling malaria in the United States. So every year now, the Centers for Disease Control and Prevention records about 2,000 cases of malaria in the US. And these are cases that are typically acquired by travel. So when people are traveling outside the United States, become infected, return home, and then start to feel unwell. And most of those are, as I said, travel-related or travel-acquired cases. But recently we've also started to see some local transmission of malaria, which is a concern because that means the local populations of mosquitoes have become infected and have the ability to transmit the parasite. So that's when we really start to pay attention that we need to increase our control and prevention efforts here at home. Yeah, so World Malaria Day is a lot of it is about raising awareness of malaria as an infectious disease that impacts the health and well-being of people throughout the world. And there's a lot that people can do. Knowing more and learning more about malaria, you can become involved in a number of different ways. You can support research and science and efforts to find better prevention and cure for malaria. You can also help scientists who are working on new ways, better ways to control the mosquitoes that transmit malaria. You can become involved in fundraising efforts and volunteer efforts through a number of different philanthropic organisations to support research and public health efforts around the world aimed at malaria control and prevention.